My name is Taylor I. Sparrow, and I did my health policy topic on the needle exchange program. The needle exchange program is a very controversial topic. This program is being implanted in many major cities to reduce the risk of spreading HIV and hepatitis infections. Some agree that using this program is a great way to prevent diseases and infections from spreading all around from person to person. However, others feel that this program is enabling drug users and sending a message to them saying that it's okay to do drugs. CNN used the example in an article that if somebody had told you that your city started a program providing clean needles to injecting drug users, would that make you want to start injecting drugs yourself? The answer, of course, would be no. Yet for decades, many have stood by the belief that such programs, known as needle exchange programs, promote and encourage drug use. Indeed, for Congress, it became the rationale behind the ban implemented in 1988 that prohibits the use of federal funds for these programs. Many risk reduction studies were done and published by harm.org, and in New Haven, needle exchange programs had a 33% reduction in HIV incidence, and in Baltimore, after 8 years of follow-up, HIV incidence decreased by 35%. The connection between needle exchange programs and reduced infection was not only limited to HIV. As the risk reduction studies were done and not only limited to HIV, it was said that in Pierce County, Washington, research indicates that hepatitis B and C cases were also attributable to injection drug use and declined by more than 75% within 2 years after the needle exchange programs were established. As you can see in the pie chart, just in 2015, 60.4% of hepatitis C infections came from injection drug use. It's easy for people that are not interested in or educated in the health field to say that these programs just enable drug users, but that's not the case, and that's why we need to implement more of these programs all around the world, because they do give people clean needles, but it reduces the risk of spreading so many diseases. Along with the quote in the photo, also according to the CDC, injection drug use is a risk factor for contracting blood-borne pathogens such as HIV and HCV. Sharing syringes provides a direct route of transmission for these diseases, and it is estimated that in 2013, 3,096 of the estimated 47,000 diagnoses of HIV infection in the United States were attributed to injection drug use. Between 2001 and 2010, HCV-infected individuals accounted for almost 3 million outpatient, inpatient, and emergency department visits in the United States. Estimated healthcare costs associated with the treatment and care of chronic HCV was $6.5 billion in 2011 and is expected to peak at $9.1 billion in 2024. The New York Times had said that syringe exchange programs do more than just improve your health. Because they are so effective and far more cheaper than the lifetime threatening cost of HIV, hepatitis B, or hepatitis C, they actually save taxpayers money. Overall, the needle exchange program is very beneficial all over the world and in different atmospheres and locations to stop the spreading of HIV and hepatitis B and C. This program overall has not led to more substance use or abuse, and this is why it is now being federally funded, which it hadn't been in the past because of the assumption that it was just enabling drug users. After implanting these programs in areas, people in surrounding communities may see it as enabling drug users, but along with providing them with sanitary syringes and a safe environment, it's also educating them and providing them with the information they need on how to get clean and their different rehab options provided by medical professionals. We need to try and implant more needle exchange programs in the United States.